In order to maximize the effectiveness of your treatments, Biocompression Systems has produced this video which contains helpful information on the setup and use of your sequential circulator system. Although this setup and the use of your sequential circulator systems may vary slightly, the majority of information in this video will apply to your specific needs. In all cases, we recommend that you carefully review the operator's manual included with your system to completely familiarize yourself with its operation. Your physician prescribed the use of this device for treatment of either lymphedema, swelling of the arms or legs, or skin ulcers associated with venous insufficiency. This device provides a deep tissue massage that helps to increase circulation. This massaging action moves the fluid out of the extremity and into the region of the circulatory system where it can be eliminated from the body. In cases where you have had surgical removal of lymph nodes, or are experiencing inhibited lymphatic or venous circulation, or if you have had inadequate functioning of the valves and pumps in the calf and foot area of your leg when walking, or due to long periods of immobility, the sequential circulator pump must act as a form of compensation. As a result, circulation is often improved along with removal of excess fluid and a decrease in swelling. Because of this, you may find that you need to urinate more frequently after treatments. Before we show you how the pump works, we want to make sure you don't have any medical conditions that would prevent the use of the system. Some of these conditions would include open infected wounds of the limb which have not been treated with appropriate antibiotic coverage, the presence of lymphangiosarcoma, a malignant cancer of the lymph system, uncontrolled congestive heart failure, deep vein thrombosis that has not been properly treated, abnormally low diastolic blood pressure, the lower of the two numbers, less than 60, inflammatory phlebitis, or during episodes of pulmonary embolism. If you have any of these conditions, contact your physician before using the system. The system you will be using consists of two components, the base unit or sequential circulator, and the arm or leg sleeve that your doctor has ordered. The first step in setting up your pump is to find a comfortable location for your treatment, such as a recliner, couch, or bed. It is important to keep arms or legs elevated during treatments. This will move the buildup of fluid more effectively. Plug in the base unit and place it on a flat surface nearby. In most cases, your dealer or provider will set up the equipment and give orientation as to its proper use according to your doctor's orders. Your doctor has prescribed the frequency and duration of your treatments along with the pump pressure settings to be used. Should you need to set or change the pressure settings, do so with the sleeve disconnected from the base unit and proceed as follows. Flip the switch up to the on position and let the pump run for approximately 5 minutes. Afterwards, place your finger over the air supply, port number 1, which is located to the far right. Partially covering the port, wait until you feel air start to come out. As soon as air is felt, fully block the port with your finger while turning the black pressure control knob on the front of the base unit, and while observing the gauge, set it to the desired pressure. Note that you may need to repeat this step several times since the cycle for chamber number 1 only lasts a few seconds, and the pressure adjustment should only be made using port number 1. If you are uncertain, use your finger to feel the air coming out of port number 1. Totally cover it and proceed only while pressure exists in port number 1. Next, remove the sleeve from the packaging and unroll it. The plastic hose attached to the sleeve plugs into the base unit as shown. Make sure the black and white tabs at the end of the hose snap securely into the corresponding black and white holes in the base unit. If you are using 2 sleeves, unplug the cover from the other connector on the base unit and plug the second sleeve into that connection. If you are only using 1 sleeve, you must leave the cover on the second connection, otherwise the pump will not function properly. Before turning on the unit, unzip the sleeve and place it on your arm or leg. You may use the sleeve over light clothing if necessary. Zip up the sleeve and make sure it fits properly. Now, turn on the unit. The sleeve will begin to inflate, first around the hand or foot. The sleeve contains 4 pressure chambers, which will inflate in sequence, moving slowly up the arm or leg. As each chamber inflates, the pressure in the chamber will be slightly less than in the previous chamber. The chambers then simultaneously deflate, and the process begins again. Note that the on-off switch may stay lit after you have turned off your unit. This is normal, as the unit's built-in timer will adjust to be ready for the start of your next treatment. Once the automatic adjustment is completed, the light will shut off. As with any medical treatment, symptoms may arise that would warrant the attention of your physician. If you should experience any of the following symptoms, discontinue the use of the system and contact your physician. Severe pain, loss of sensation, coldness or cramping, acute redness with sudden inflammation and fever in the extremity, shortness of breath. Any of these symptoms could be a complication of your condition, and you should contact your physician immediately. Should you have any questions regarding the operation of your equipment, contact your dealer or provider. If they are unavailable, you may contact Biocompression Systems at our toll-free number, 1-800-888-0908. Be sure to have the model and serial number available when calling. The serial number can be found on the rear of the base unit. This video has been brought to you by Biocompression Systems, manufacturers of therapeutic devices for the hospital, nursing home, home care, and sports medicine industries. These devices include support surfaces featuring the low air loss mattress system, our alternating pressure mattress system, and the bariatric model. Sequential circulator systems featuring model 2004, 3004, and our new model 3008 8-chambered system. Cryocompression systems featuring the Bio-Cryo system, especially popular with trainers of professional sports teams as well as colleges and high schools. For more information, call customer service at 800-888-0908.